activities? Answer: properly fitting helmets help prevent head injuries during activities such as cycling, skateboarding, and skiing. Question: how can the risk of pediatric sports-related injuries be managed? Answer: implementing proper training techniques, using protective equipment, and promoting sports safety education help manage the risk of sports-related injuries. Question: what is the significance of pediatric fractures and growth plate injuries? Answer: pediatric fractures may involve growth plates, affecting future bone growth. Proper management, monitoring, and follow-up are important to prevent complications. Question: how can the risk of pediatric drowning be minimized? Answer: supervising children around water, teaching swimming skills, using barriers around pools, and promoting water safety education help prevent pediatric drowning. Question: what is the role of child-proofing measures in preventing pediatric injuries at home? Answer: child-proofing involves securing cabinets, installing safety gates, covering electrical outlets, and removing potential hazards to create a safe environment. Question: how can the risk of pediatric poisoning be managed? Answer: storing medications, cleaning products and toxic substances out of reach, using child-resistant packaging, and teaching poison prevention measures help manage this risk. Question: what is the significance of pediatric abdominal trauma? Answer: pediatric abdominal trauma can involve solid organs, hollow viscera, and abdominal wall injuries. Prompt recognition and surgical intervention, if needed, are crucial. Question: how can the risk of pediatric bicycle-related injuries be minimized? Answer: ensuring proper helmet use, teaching bicycle safety rules, and using designated bike lanes help minimize the risk of pediatric bicycle-related injuries. Question: what are the common mechanisms of pediatric injuries? Answer: pediatric injuries can result from falls, sports-related accidents, motor vehicle collisions, burns, poisoning, and other accidental or non-accidental causes. Question: how does the assessment of pediatric injuries differ from adult injuries? Answer: assessing pediatric injuries requires consideration of growth plates, unique anatomical differences, and age-specific responses to trauma, such as compensatory mechanisms. Question: what is the role of developmental stages in understanding pediatric injury patterns? Answer: understanding developmental stages helps predict injury risks, such as crawling infants being prone to falls and adolescents having increased sports-related injuries. Question: how can the management of pediatric injuries be influenced by psychological factors? Answer: pediatric patients may experience anxiety, fear, and pain differently. Proper communication, child-friendly environments, and involving caregivers are crucial. Question: what is the significance of non-accidental trauma, child abuse, in pediatric injuries? Answer: non-accidental trauma involves intentional injury inflicted on a child. Recognizing signs, reporting suspicions, and involving child protection services are essential. Question: how can the risk of pediatric burns be minimized? Answer: practicing proper supervision, child-proofing the home, avoiding hot liquids or surfaces, and teaching fire safety help minimize the risk of pediatric burns. Question: what is the role of pediatric-specific restraint systems in preventing injuries during motor vehicle collisions? Answer: properly using age-appropriate car seats, booster seats, and seat belts helps prevent injuries and fatalities in pediatric passengers. Question: how can the risk of pediatric falls be managed? Answer: creating safe environments, using safety gates, securing furniture, and supervising children during playtime help manage the risk of pediatric falls. Question: what is the significance of pediatric traumatic brain injuries, TBI? Answer: pediatric TBIs can have long-term cognitive, behavioral, and developmental consequences. Early recognition, proper management, and rehabilitation are vital.
Question: what is the significance of pediatric spinal cord injuries? Answer: pediatric spinal cord injuries can have long-lasting functional implications. Proper stabilization, management, and rehabilitation are important for optimal outcomes.
Question: how can the risk of pediatric suffocation and strangulation be minimized? Answer: removing crib bumpers, ensuring proper sleep environments, using age-appropriate bedding, and teaching caregivers safe sleep practices help minimize these risks. Question: what is the role of pediatric-specific emergency response protocols in schools and daycare centers? Answer: having age-appropriate emergency plans, conducting drills, and training staff members to respond to pediatric emergencies help ensure child safety. Question: how can the risk of pediatric foreign body ingestion be managed? Answer: supervising playtime, using age-appropriate toys, teaching children not to put small objects in their mouths, and providing first aid training for choking help manage this risk. Question: how can the risk of pediatric concussion and mild traumatic brain injuries be managed? Answer: educating children, parents, and coaches about concussion recognition, providing appropriate rest, and gradually returning to activities help manage this risk. Question: what is the role of pediatric-specific psychosocial support in managing injuries? Answer: offering psychological support, addressing anxiety or fear related to injury, and involving child life specialists help manage the psychosocial aspects of pediatric injuries. Question: how can the risk of pediatric bicycle-related head injuries be minimized? Answer: ensuring helmet use, teaching safe riding practices, and modeling helmet behavior as caregivers help minimize the risk of head injuries in pediatric cyclists. Question: what is the role of pediatric-specific pain management strategies in managing injuries? Answer: providing age-appropriate pain relief, utilizing distraction techniques, and addressing psychological aspects of pain help manage pediatric injuries. Question: how can the risk of pediatric heat-related injuries be managed? Answer: avoiding hot vehicles, providing adequate hydration, and using sun protection measures help manage the risk of pediatric heat-related injuries. Question: what is the significance of pediatric pelvic fractures? Answer: pediatric pelvic fractures can involve growth plates and may lead to long-term functional consequences. Proper assessment and management are important. Question: what is the significance of pediatric limb injuries? Answer: pediatric limb injuries can impact growth and function. Proper splinting, casting, or surgical management is important for optimal healing. Question: how can the risk of pediatric motor vehicle collisions involving pedestrians be minimized? Answer: teaching children pedestrian safety rules, using designated crosswalks, and promoting road safety education help minimize the risk of these collisions.
Question: what is the role of school safety measures in preventing pediatric injuries? Answer: implementing safety protocols, supervising students, maintaining playground equipment, and teaching safety education contribute to pediatric injury prevention in schools. Question: how can the risk of pediatric firearm-related injuries be managed? Answer: practicing safe firearm storage, keeping firearms unloaded and locked away, and educating children about firearm safety help manage this risk. Question: what is the significance of pediatric musculoskeletal injuries? Answer: pediatric musculoskeletal injuries can affect growth and development. Proper diagnosis, management, and follow-up are important for optimal outcomes. Question: how can the risk of pediatric electrical injuries be minimized? Answer: covering electrical outlets, using child-resistant plug covers, keeping cords out of reach, and teaching children about electrical safety help minimize this risk. Question: what is the role of playground safety measures in preventing pediatric injuries? Answer: maintaining safe playground equipment, providing adequate supervision, using soft landing surfaces, and promoting playground rules help prevent injuries. Question: how can the risk of pediatric dog bites and animal-related injuries be managed? Answer: teaching children how to interact with animals, supervising interactions, and educating caregivers about pet safety help manage this risk. Question: what is the significance of pediatric facial trauma? Answer: Pediatric facial trauma can lead to functional and aesthetic consequences. Proper assessment, imaging, and surgical intervention, if needed, are important. Question: how can the risk of pediatric motor vehicle collisions be minimized? Answer: properly using car seats, booster seats, and seat belts, obeying traffic laws, and avoiding distractions help minimize the risk of pediatric injuries in motor vehicle collisions. Question: what is the role of pediatric-specific burn centers in managing burn injuries? Answer: pediatric burn centers provide specialized care, pain management, and emotional support for pediatric patients with burn injuries. Question: how can the risk of pediatric poisoning from household products be managed? Answer: storing household chemicals in locked cabinets, using child-resistant packaging.
Question: what is the significance of pediatric abdominal compartment syndrome? Answer: pediatric abdominal compartment syndrome involves increased intra-abdominal pressure. Early recognition and intervention are crucial to prevent organ dysfunction. Question: how can the risk of pediatric near-drowning incidents be managed? Answer: providing proper supervision around water, teaching swimming skills, and promoting water safety education help manage the risk of pediatric near-drowning incidents. Question: what is the role of pediatric-specific rehabilitation programs in managing injuries? Answer: pediatric rehabilitation programs focus on age-appropriate therapies, play-based interventions, and family involvement to facilitate optimal recovery. Question: how can the risk of pediatric electrical injuries be minimized? Answer: educating children about electrical safety, keeping cords out of reach, and using child-resistant plug covers help minimize the risk of pediatric electrical injuries. Question: what is the significance of pediatric thoracic trauma? Answer: pediatric thoracic trauma can involve lung contusions, rib fractures, and pneumothorax. Proper assessment, monitoring, and supportive care are important. Question: how can the risk of pediatric choking on food be managed? Answer: cutting food into small pieces, teaching children to chew properly, and supervising mealtime help manage the risk of pediatric choking incidents. Question: what is the role of pediatric-specific mental health support in managing trauma-related stress? Answer: offering psychological interventions, counseling, and addressing trauma-related stressors help manage the mental health aspects of pediatric injuries. Question: how can the risk of pediatric falls from heights be minimized? Answer: installing safety gates, using window guards, supervising play near windows or balconies, and teaching children about fall prevention help manage this risk. Question: what is the significance of pediatric vascular injuries? Answer: pediatric vascular injuries can lead to ischemia and complications. Early recognition, vascular surgery intervention, and proper wound care are important. Question: how can the risk of pediatric vehicular heat stroke be managed? Answer: avoiding leaving children unattended in vehicles, using reminders or alarms.